Greetings, Professor Andy. Greetings, Bettina and Ayn. So my name is Sonia, and I'm from Empower School of Health. I'm so sorry for the disturbance. So now we will be starting the session as per the schedule. So as you can see over here, the webinar is on ethical laboratory practice, ethical leadership and management of waste. The presenters for today's webinar is Professor Andy and Dr. Ayn. We have two panelists, Mr. Akalu and Professor Rajiv. And for today's, the moderator for this session is Dr. Bettina. Just give me a sec. I have few housekeeping announcements for participants. Kindly mute your mic and turn off your cameras. Please ask your question using the chat box. We will be having a Q&A session at the end of this webinar that is devoted for 10 to 15 minutes. So if you have any questions, please put your questions on the chat box. Unfortunately, we do not have a poll for this session. Webinar recordings will be available at the Empower School of Health YouTube channel. The slide deck will be shared with all participants. We have 3 housekeeping announcements for speakers. Please turn on your cameras for better engagement. Please mute your microphone when another speaker is speaking. Please adhere to the webinar schedule timing. The webinar objective, as you can see on the screen, the main objective of this webinar is to deliver and explain about the ethical laboratory practice, ethical leadership, and management of waste. Now I would give the floor to Bettina to take it further from here. Bettina, over to you.
Thank you very much, Sonia. I appreciate that. Good morning, everyone. As you indicated, I'll be the moderator for this session. And I'm going now to pass to Dr. Ian Machingura to actually welcome everybody. Thank you. Dr. Ian?
All right. Good morning, and thank you, Bettina, and thank you, Sonia. And I just want to welcome you all to this first of the series of webinars from the African Consortium of Laboratory Systems Strengthening, which is composed of University of Zimbabwe, Department of Laboratory Diagnostic and Investigative Sciences, the Cape Peninsula University of Technology, Department of Biomedical Sciences, Stellenbosch University Division of Chemical Pathology, and University of Pretoria Department of Chemical Pathology in collaboration with the African Federation of Clinical Chemistry and Laboratory Medicine and Empower School of Health. As we seek to strengthen the lab systems in Africa, we note our challenges are the same, and we can share what we have, the knowledge that we have to improve one another. Hence, this webinar today on ethical leadership and waste management, which are essential issues in Africa as we work in the lab. We need ethical leadership to enable us to function well, and we also need to manage the waste that we have in the lab. So we have 2 speakers that will be speaking today, and we look forward to a fruitful deliberation. Thank you very much, Bettina. Over to you.
Thank you very much, Dr. Machingura. And now we are going to ask Mr. Akula to give us a brief introduction. Over to you, Mr. Akalu. Is he available? Are you in the meeting?
Is not available, but we just want to acknowledge the contribution from all the stakeholders, the African Federation of Clinical Chemistry and Laboratory Medicine, and Empower School of Health, and the universities, that's University of Zimbabwe, Cape Peninsula, University of Technology, Stellenbosch University. And it is through the working together of partners that we are able to empower one another in this journey in Africa as we seek to strengthen the lab system. And we do hope from this effort of empowering one another will improve the quality of lab results in laboratories in Africa, which would translate to better health. And we want to acknowledge all these partners for their work and their efforts in ensuring that we can host this webinar. And we want to thank the panelists and the speakers for availing themselves and for taking their time to prepare, and we look forward to a good time. Thank you.
Thank you very much for that beautiful introduction, Dr. Machingura Rurezo. And we are now going to go to the next speaker, the first speaker actually, who is actually Dr. Ian himself, and he'll be talking to us on the ethical leadership and quality management during the COVID-19 pandemic. Dr. Ian, you may start with the presentation. Thank you.
Thank you very much. This talk comes from a discussion which we have had with Prof. Rajiv Erasmus, whereby we were saying that quality management is essential, but you can't have quality management without ethical leadership. And these two are so integral in the function of the lab. And the COVID pandemic gave us the chance to note that the importance of ethical leadership, which result in quality management systems that are good in the lab and which result in good laboratory results. And hence the topic ethical leadership and quality management during the COVID-19 pandemic. All right, it's ticking. Let me just try to, all right. Ethics and core ethical principles. Ethics is a set of principles of right conduct. And the core ethical principles which are applicable are respect for persons, beneficence, justice, and these principles are applicable in research and in the clinical setting, which includes laboratory medicine. And all the phases of laboratory practice, that is the pre-analytical, analytical, and the post-analytical phases of the laboratory practice. And we note leadership is filled with concepts that are often not agreed upon in terms of the definition. But I tend to agree with the definition that has been coined by Kouzes and Posner, which says leadership is the art of mobilizing others to want to struggle for a shared aspirations. And you find in the laboratory context, leadership is exercised through the management, be it senior management or middle management. And managing a diagnostic laboratory is complex. It involves decision-making, human resources, financial and material resources, regulatory compliance, an issue which my colleague, Prof. Andy Backlow will talk about in terms of waste management, mentoring and training, and interpersonal relationships. And ethical leadership is needed in the lab. Ethical leadership is the one that keeps organizational goals and practice standards and codes of conduct at the forefront. And with ethical leadership, the lab develops and the leadership communicates good policies and procedures which has been developed. And ethical leadership supports staff and treat all fairly, and they remove obstacles to quality of service. And they provide training opportunity on ethical behavior, just as we are having today in training on ethical behavior. There is always a dilemma, however, on how to balance the desire for productivity against competing values, such as treating people fairly and promoting the well-being of individuals. Leaders are important because they define and empower the people in the organization, and also has an important role of changing the workplace culture. And the workplace culture is important, and it determines how we do business in our labs. And this is essential also because inadequate emphasis on quality of services results in poorer patient outcomes, inefficiency, and poor economic outcomes. And leaders in the lab define the culture. They can change the work culture. And leaders, if they encourage a culture of quality, we result in a lab having an environment in which employees not only follow quality guidelines, but also consistently see others taking quality-focused actions. And they hear others talking about quality in the lab, and they feel quality all around. And it is essential that management should walk the talk, and the talk should be through the budget and the finances, and that the finances is indicated by the time allocated. The time is money, the time which staff is allocated to work on quality issues, on developing the policies, the procedures, and ensuring that the quality control, quality assurance measures are in place, and even accreditation measures are in place, and the staff that are allocated to do this job. And in some labs, when it's a bigger lab, you actually have the ability to appoint a quality manager who is responsible for quality, or allocate time for someone to be working on quality issues in a lab who also have other lab duties, depending on the nature of the operation. But that from the management shows their commitment. And the budget that they allocate to quality also reveals what importance they attach to quality. Because quality is not cheap. There is a cost to quality. However, poor quality has a higher cost. And ethics in the medical laboratory. The decisions about diagnosis, prognosis, and treatment are frequently based on results and interpretation of lab tests. And irreversible harm may be caused by erroneous tests. So we need to take our work seriously. The sample that we have, no matter what it is, no matter if it's a research sample or it's a diagnostic sample, we need to take it serious. There is need to adhere to high ethical standards wherever we are for the benefit of the patient or the research participant. And the management lead by example. If they just say something, but they don't do it, it always translates to the employees or the other employees in the lab noting that it's just cheap talk. Examples of the COVID pandemic, during the peak of the COVID era, we noted that COVID-19 testing was essential for diagnosis of the disease, and it supported public health efforts to prevent further spread of the disease and in disease management. And it helped us in the lab to get mileage. Everyone knew about lab testing. My old father, who is not even a medical personnel, and my mother, who are all in the administration function, actually know about lab, about the test. People actually knew about PCR. They could talk about PCR, a good report, a bad report. And this brought the lab to the forefront and the need for quality lab results. And we know that during the COVID pandemic, other diseases were still occurring, and the timely diagnosis would facilitate early management of the disease, increasing the recovery rate, lowering the mortality of COVID-19. And us in the lab were able to be seen as champions during the COVID-19 pandemic. However, the quality of the lab result is as important as the turnaround time. In as much as we had pressure on producing results and having them out in a certain time, but we needed to ensure that we have quality results. That should translate to all other tests that we do in the lab. And also the cost must not be compromised. The result must be accurate and reliable for all test results. And the challenges that we can learn from the COVID-19, we had increased workloads, short staffing, declined in experienced lab personnel. Some were even dying due to COVID-19. I lost some of my work colleagues. And this is worrying. And because it affects the ability to produce reliable and timely lab results and ensure patient safety. To ensure safety, there is need for well-trained, knowledgeable workforce. So this calls the training institutions to be producing knowledgeable workers who will be able to be absorbed into the labs, and the work schedules also in the labs should allow for manageable workload, and the system should support efficient and safe working conditions in the lab. And without ethical leadership, you can't have quality management, because a quality management system can only be led by ethical leadership. Quality management system is defined as coordinated activity to direct and control an organization with regards to quality. All aspects of the laboratory operation, including organizational structure, processes, and procedures, need to be addressed to assure quality. Well-established and functional quality management systems are an integral part of any diagnostic lab, and they assure the reliability and the standard of the lab function. And the implementation of the quality system in diagnostic lab would ensure accurate, reliable, and efficient test results, which are at par with international standards. We noted with the COVID-19 pandemic that people wanted to know, how would you trust the result from country X, from lab X? High quality laboratories which detect errors and prevent them from recurring occur when we have a quality management system. And as we noted, the COVID-19 caused the averted and test demand exceeded capacity, causing backlog for testing, and the reasonable turnaround time was no longer possible. The demand for laboratory reagents and equipment exceeded the capacity to supply, transport the reagents and consumable and equipment across the countries. The transportation was affected. The service engineers were oversubscribed, and we had restricted travel due to lockdown measures. And also lab staff were burnt out. Some were in quarantine. Numbers of samples were exceeding the capacity for pre-testing storage. So we have a lot to learn from how we manage the pandemic in our lab. We need to see how we fared as labs, and see how we can better improve ourselves, and also implement the quality management system to help us do well. And the 12 quality management systems essentials are organization, personnel, equipment, purchasing and inventory, process control, information management, document and records, occurrence management, assessment, process improvement, customer service, facilities, and safety. The organization, in order to have a functioning quality management system, the structure and management of the lab must be organized so that the quality policies can be established and implemented. There must be a strong supporting organizational structure. management commitment is crucial. There must be mechanism for implementation and monitoring within the lab. And the personnel is the most important laboratory resource, and it must be competent and motivated. And the quality management system addresses many elements of personnel management and oversight. Your recruiting, how do you recruit, how do you retain the qualified staff, and well-trained and competent staff who perform and manage the activities of the lab are essential, and they need to be managed well within the lab. Equipment is also essential. Equipment is used in the laboratory, and each piece of equipment must be functioning properly, and hence the need for all the maintenance, the preventive maintenance, the routine maintenance. And also the choosing of the right equipment, installing it correctly, ensuring that the new equipment works properly, and having a system for maintenance are all part of equipment management program in a quality management system. Correct equipment selection, correct installation, the proper maintenance, calibration of equipment, and record maintenance are also essential within the lab. And the purchasing and inventory are also essential. The management of the reagents and supplies in the lab is often a challenging task, and we noted it even during the pandemic or the COVID-19 pandemic. Proper management of purchasing and inventory produce cost saving in addition to ensuring supplies and reagents are available when needed. So this needs to be managed properly. Procedures that are part of management of purchasing and inventory are designed to ensure that all reagents and supplies are of good quality, and that they are used and stored in a manner that preserves the integrity and the reliability. And process control is also important, which comprise of several factors that are important in ensuring the quality of lab testing processes. The factors include your quality control for testing. It should be in place, and appropriate management of the sample, including collection and handling. This also needs to be taken care of, because the quality of sample also determines the quality of a result. And also your method verification and validation are also important. Information management, the product of laboratory processes is information primarily in the form of test reports. And the information or the data must be managed carefully to ensure accuracy and confidentiality, as well as accessibility to the lab staff and to the healthcare providers when needed. It doesn't matter whether a paper system or a computer system is used, but it just needs to be properly managed. Documents and records. Many of the 12 quality systems essentials overlap. For example, there is close relationship between documents and records and information management. Documents are needed in the lab to inform how to do things, and laboratory always have many records and many documents in the form of your policies, your SOPs. These documents must be managed properly, and the record must be meticulously maintained so as to be accurate and accessible when needed. And there is a cost to it. You need to have a budget cost for where to store it and how it's stored, and even if it's paper system or a computer-based system. Occurrence management. Occurrence is an error or an event that should not have happened. A system is needed to detect these problems or occurrence, to handle them properly and to learn from the mistakes and take action so that they do not happen again. We need to be able to prevent them from happening. Assessment. The process of assessment is a tool for examining the laboratory performance and comparing it to standards and benchmarks or the performance of other laboratories. Assessment may be internal, which is performed by the laboratory using their own staff, or may be external, conducted by a group or an agent outside the laboratory, your accreditation organizations. The laboratory quality standards are an important part of the assessment process, and they serve as a benchmark for the laboratory. And the management needs to be aware of it and be applying. process improvement. The primary goal in quality management system is continuous improvement of the laboratory processes, and this must be done in a systematic manner, not in a haphazard manner. Customer service. The concept of customer service has often been overlooked in the laboratory practice. Laboratory is a service organization. We must realize that we are providing a service. We are providing the lab test, and therefore it is essential that the clients of the lab receive what they need when they need it. The right result at the right time, at the right cost, and using the right reference range. And laboratories should understand who their customers are and should assess their needs and use customer feedback for making improvements. There should be a way of capturing your customer feedback. Facilities and safety. Many factors must be part of the quality management of facilities and safety. This includes security, which is the process of preventing unwanted risks and hazards from entering the laboratory space, and containment, which seeks to minimize the risk and prevent hazards from leaving the laboratory space and causing harm to the environment. Safety, which include policies and procedures to prevent harm to workers, the visitors, and the community. And I'm grateful Prof. Buckley will be able to talk on waste management after the talk. Ergonomics, which addresses facilities, equipment, and adaptation to allow safe and healthy working conditions at the laboratory site. And the quality management system model is that all the 12 essentials must be addressed to ensure accurate, reliable, timely laboratory results and to have quality throughout the lab operations. It is important to note that the 12 quality system essentials may be implemented in the order that best suit the laboratory. And it's a leadership which is ethical, which is able to map out the strategy within the lab. And the approaches to the implementation vary with the local situation and the situation in the lab. The lab not implementing a good quality management system are guaranteed that there will be many errors and problems occurring that may go undetected. Implementing a good management system may not guarantee an error-free lab, but it does yield a high-quality laboratory that detects errors and prevents them from occurring. In conclusion, leaders are accountable for the success and the failure of the laboratory, and they should lead by example. Management support is essential for successful quality management system. A successful quality management system is often described using the 4 principles. Say what you do what you say, prove it, then improve it. How do you say what you do? Through your documents, policies, processes, and procedures, and make the intention transparent. It doesn't help for the management to think in their heads of the good policies without letting the employees know and the direction where the lab is to go. Do what you say. Provide training and support to understand and follow the procedures. Use the processes and procedures as the basis for the training. And this can only be done with leadership support. Prove it. Audit the processes and the system. Check the results, the records for evidence of compliance. Do your internal quality checks. Do your external quality checks, your accreditation process. Improve it. Audit the system for efficiencies and opportunities for continuous improvement. Correct the things that do not turn out the way they were designed to, and prevent them from recurring in order to continuously improve the system. Ladies and gentlemen, I hope I made my point clear. You cannot have quality management system without ethical leadership. And the COVID-19 pandemic was an opportunity for us to see how we as a lab fare. And it enables us to assess ourselves. It enables us to prepare for future pandemics. I rest my case. These are my references. Thank you very much. Over to you, Bettina. Thank you very much.
Thank you very much, Dr. Ian. We are very much within time, but I'm going to suggest that we go to the next speaker, if it's fine with Prof. Andy, so that we can have enough time for the questions and answer sessions when we actually round the sessions up. But I must comment a little bit that each time I hear you speak on the ethical leadership in laboratory science, it actually literally reminds us and put very clear that without ethical leadership in laboratory science, labs are not going anywhere. But we will have the questions and answer sessions later on. Prof. Andy is one of our known colleagues. We've been on these sessions together for a very long time. And Prof, as is known by many of us, is the director of the training and capacity building of the Empower School of Health. Over to you, Prof.
Greetings and welcome. Then I think we go to the next slide straight away, please, Sonia. Just a few words about the Empower School of Health. We are a university and consultancy. I can see from the names we have with us today that many of our alumni and current students are with us, so welcome to you all, and to all those who are joining us for the observation of Ramadan, particular welcome for taking the time to be with us today. Next slide, please. A little bit about Empower. We really have three focus areas: leadership and change management, digital learning, and many of you will have taken part in our courses and webinars already, and public health, procurement and supply chain. And today we really try to combine all three of those as I talk about waste management for laboratory products. Next slide, please. We have partnerships throughout the whole global activities, but especially here in Africa, and you can see many of them on the screen now as we try to link. We don't try to be a standalone, we try to transfer our knowledge to local institutions and organizations. We have a fully international faculty, people from all around the world, and we are exceptionally blessed to have the former president of Ghana, His Excellency John Kufuor, with us as part of our Mentors and Guidance program. Next slide, please. We have a whole lot of specific online courses. Most are available in English and French, from our master's degree in global health procurement and supply chain and postgraduate diploma through to individual short 2-month courses in particular areas. And the next slide, please. And yet more courses that we offer. These are all available online. They are not free. You do have to pay for them. We do have a few free courses. You can find those on the Empower website. Okay, so really, to what extent does clinical laboratory waste management need to adapt to post-COVID? COVID's been a massive shake-up for everyone in the field. What's happened to us on waste management? And I'll try to explain why I think it's so important. Next slide, please. Our key message is from Dr. K. Park: let the waste of the sick not contaminate the lives of the healthy. And unfortunately, we're not very good at stopping that. We are allowing the waste to contaminate the lives of the healthy. And that's a situation that we have to address, because it's only going to get worse. And just basic, simple, low-cost management procedures can address all of that. And they're critical to what we do in clinical laboratory. Next slide, please. Well, before COVID hit, the waste management was already in a mess. It was often not managed at all. There was poor awareness of the health hazards. There was inadequate training. Nobody wanted to know about waste. Nobody wanted to know about new developments and state-of-the-art in waste disposal. Nobody wants to know about the policies and the procedures that are already there. The World Health Organization has excellent procedures. The International Solid Waste Association. Nobody even knows what the Basel Convention is unless you've taken one of our online courses. What's the Basel Convention got to do with laboratories? Well, we'll explain it in a little while. But all of those are key areas which were all totally neglected before COVID. And the next slide, please. Well, how was biomedical waste specifically before COVID? In the surveys, half the workers had no knowledge about what they were handling, about the waste and its toxic effects. About 40% of workers in the field had been injured, often from sharps, from needle stick or sharp stick. The waste was not being segregated into different categories. One of the most fundamental parts of waste management, segregation of waste, wasn't happening. And workers are not being trained, and lab staff are not being trained in waste management. Next slide, please. Then along comes COVID. So even before COVID hit, the survey indicated 1 in 3 healthcare facilities were not handling their waste safely before COVID hit. Then along comes COVID with all these extra diagnostic testing, extra volumes, extra hazardous chemicals. I'm sure that the lab staff know the details of the PCR cartridges for SARS-CoV-2 testing and the presence of GTC. What's so special about GTC? You cannot disinfect using bleach. It will generate cyanide gas, which is very toxic. So we have to have a slightly different treatment profile for the COVID PCR cartridges. But in general, the most impact of COVID on lab waste was the volume, much larger volumes of waste being generated. Next slide, please. I said at the start, let not the waste of the sick affect the health of the well-being of healthy people. Unfortunately, it is affecting. It's affecting the Sustainable Development Goals. Here is the way, the ones in red, are how it's negatively affecting the Sustainable Development Goals, because the waste is infecting people. It's carrying risks of infecting people. It's degrading the environment in which they live. And that's the waste that we are generating in the clinical laboratory today. It's affecting the well-being of the healthy. And that's a situation which we must address. Next slide, please. Well, what is the big impact of COVID specifically on clinical laboratory waste? And it's really a triple whammy. We've had a massive surge in the volume of waste being generated. We have a massive increase in the number of ad hoc testing centres. Whether we call them laboratories or not, they were testing centres. What happened to all the waste that those testing centres generated? And then we've changed the composition of laboratory waste. It now contains far more plastic than it did in the past. These volumes are important because they affect everything we do around laboratory waste. So we've had extra volume, new generation sites, and a change in the waste composition. All of those are major impacts around laboratory waste. Next slide, please. And if we look at the increase in the volumes, this is data from Asia, healthcare waste. In Manila, we went from 47 tons per day to 280 tons per day, 5 times more volume. And similarly across. And we look at specific hospitals, we find the same kind of ratios. Before COVID, 267, during COVID, 600, 3 times more volumes of waste from the hospitals generated medical waste. massive increases, 3 and 5 times, 500% increase in the waste volumes. Next slide, please. But it's not just COVID. Many of you working in the field will have also had to respond to the monkeypox sudden flurry that we had. And those further north will have looked at Ebola and probably Lassa fever as well. All extra test kits, all extra tests that need to be done, all urgent, all large volumes at the time, adding to the waste load. Next slide, please. Then there's these new COVID testing sites where we had the not PCR, we had the rapid diagnostic test kits being used. What's happening there? And largely the answer is we don't know, because they don't report. These sites, we don't know what's happened to the waste. We don't have any good information because we don't get reports from them. They were set up quickly. They've been dismantled quickly. What's happened to all the waste? No idea. We don't know where it's gone. So we have a lot of unknowns around generated waste, and particularly around the volumes that these ad hoc testing stations produced. Next slide, please. The mix, the makeup of the waste from the clinical laboratories have also changed. We have a much larger plastic content. And that's made even worse because we're not good at segregating the waste. Most of this plastic actually comes from the packaging. It is not hazardous waste. It can be disposed of as ordinary domestic refuse. But because we're not segregating properly, it's going into the hazardous waste bag. It's massively increasing the volumes that we've got. Far more plastic. And as we try to incinerate that plastic, it produces lots of problems. It produces noxious gases and it damages the incinerator. Next slide, please. So the point about this plastic is we have to separate, we have to segregate waste. That's basic waste management. It's particularly important around the COVID response because of all the extra PPE. And this PPE all comes wrapped in plastic, which we have to treat separately to the hazardous waste. Also, in low temperature incinerators, burning plastic destroys the incinerator. It makes real problems all the time. And we have to get away from using that in that way. There are various ways to try and recycle the plastic. The main point is to segregate the plastic. Well, what about the plastic in the rapid diagnostic tests? No, that's hazardous material. That's infected material. That we can't separate out. That we have to handle. Next slide, please. Well, is that plastic really that much of a problem? So we have this term MMPW, mismanaged plastic waste. And if we look for Africa, we find it's actually quite low compared to Asia. Asia is much higher. They're handling far higher volumes of plastic than the African continent is in general. Much higher than Europe even, and part of that is the population. So in Africa, it is not yet so much of a problem. Does not mean we can be complacent. It means that we do have to be aware of the real threat to plastic in the environment because we're using huge amounts of plastic and we have to manage that correctly. Next slide, please. And people misunderstand around the plastic. They think all this plastic is coming from the test kits. Well, if we look at the graph here, we can see the hospital produces a large amount of plastic, but the test kits are actually a very small component. You can hardly see the bar charts on the test kits. Most of the plastic is coming from packaging material, which means it's domestic refuse. We don't have to look at hazardous disposal techniques. Most of that plastic is coming from the PPE. So if we can regulate PPE and use it wisely, we can reduce the plastic content. It's not actually the test kits themselves that are generating that much plastic waste. Typically, 1,000 PCR tests generates about 40 kilos of plastic. It's not that much in comparison to other areas, but we get far more plastic generated in the packaging material and the PPE. Recognize the source of it, and that makes the segregation of the waste all the more important. Next slide, please. Well, lab waste, is it really a problem, this lab waste? Is it really such a big issue compared to what the hospital other departments are generating? We look at the graph here, bear in mind that it's a logarithmic scale. So the hospital is producing around 2 kilograms per person of plastic, but the lab is only producing about 0.06 kilograms. It's a very small amount compared to the other hospital departments. The lab is not a major source by volume of the plastic. Further, most of what the lab is producing, the lab waste, is not hazardous material. Only less than 25% is actually hazardous. The vast majority of the waste is normal domestic waste that can go to general landfill sites. It's only around 25% that I really need to handle carefully and to control hazardous contamination. Next slide, please. So again, medical laboratories, whether they're in hospitals or they're off-site as independent units, do not generate that much hazardous waste. Figures vary between countries a lot, but basically everyone agrees it's less than 10% of all the medical hazardous waste that's being produced. Lab is not a big volume producer of hazardous waste. Figures on the screen from China and from other countries as well, from Indonesia, giving examples of particular national and specific hospital averages. Next slide, please. Well, in that case, we don't need to worry about it. We're only doing a little bit. It's not that important, is it? Well, unfortunately, toxic is toxic. You can't be a little bit dead. You're either dead or you're not. Yeah? And we have to understand this is hazardous material. It can damage people's health and perhaps even life. We must take the situation seriously. And that's a problem because most laboratory personnel have never been trained in waste management. They don't know anything about the environmental regulations. They don't know anything about the Basel Convention, which specifies how waste is to be treated in law. And yes, your country signed up to the international agreement on it, all on the list. But we have to think beyond that. It's not just morbidity and mortality, as important as they are, it's the public scandal. It's the loss of funding from donors because of that scandal. Some manufacturers now are refusing to supply laboratories that don't have good waste management. It's the legal and moral liability. We're talking about ethical laboratory management and leadership. Ethical means that we do not contaminate people with our waste products. We manage our waste properly in accordance with the environmental regulations, the guidelines and laws. We can no longer afford to be in breach of them. It's no longer enough to say, I didn't know. I never got trained in the environmental regulations. If we're running a laboratory, we are ethically, legally, morally responsible for that waste. And we must manage it properly and in a way which will prevent damage to the environment and to human and animal life. Next slide, please. And as we look around the world, this data is from India. During COVID, laboratories are failing to manage the waste. Largely, they're overwhelmed by the sheer volume of waste. They don't have the frameworks, they don't have the infrastructure, they don't have the expertise, training and knowledge in how to handle waste. And we have the UNICEF report, which just says how poor waste management is. All around the world, in low and middle income countries, it's a neglected area. Nobody wants to know about it. Certainly nobody wants to pay for it. Yet, if we are undertaking laboratory management, it is an integral and essential part of our operation. It's something we must do. Next slide, please. Well, that's okay, Prof, but COVID's over now. Well, we can go back to normal, can't we? Well, first of all, COVID is not over. World Health Organization says COVID-19 remains an acute global emergency. It still publishes weekly epidemiological bulletins, and you can see in some parts of the world, COVID is increasing. So COVID's not over, but the volume of activities around COVID is probably reducing. So we don't need to worry because we got all that extra capacity during COVID. And that's the first one. We didn't get extra capacity during COVID, and I'm going to explain that. But also, if we take the lessons from Ebola, when there was an Ebola epidemic, all the measures that were put in place for waste management, all excellent, all there on the ground, they're already falling apart. They're already being neglected because nobody wants to look at waste. And we can fully expect the same to happen around COVID. Firstly, even before COVID, we were not meeting the treatment capacity that we were generating. We were generating more hazardous waste than we had the capacity to treat safely. Yes, the peak from COVID has reduced the amount of waste being generated, but it's still higher than it was before. We need to make up that treatment capacity to manage the volume of waste that we're generating. Next slide, please. We have this fallacy that there was extra waste treatment capacity during COVID. If we look around, no, there wasn't. What was happening is that usually we put it out to a few private contractors who just went and dumped it. We actually follow through where that lab waste went. It just went to the municipal dump. We may have even separated it. We may have segregated it properly into hazardous and non-hazardous waste and sharp boxes, all different colored bags. And then we gave it to a contractor who just went out and dumped it on the site. And then the waste collectors rummaged through it to recover what they could, giving infection and a boost to the environmental infection and hazards to human health. We didn't manage the process. We tried to outsource it without managing, without the technical competence to ensure that we were getting proper disposal. If we're going to outsource waste, we have to monitor, we have to manage the whole process. It's not enough just to have a waste collector pick it up and forget about it. We are ethically, morally, legally responsible for that waste and its eventual disposition. Next slide, please. I want to talk about the fallacy of quick fixes. Far too often I hear the message, we just need an incinerator. If we had our own incinerator, the whole problem would be taken care of straight away. That's all we need. Just get us the machine and it's all fixed. Put it next to the lab and then it's straightforward. We'll take care of it. No, that almost never happens. There are plenty of good incinerators around, but they only work as part of a full management system. An incinerator on its own is totally useless and can make the situation even worse. Message is a total waste management system. It's like buying one piece of lab equipment and saying that's going to solve all your problems. No, it doesn't. If you don't have the reagents, if you don't have the support, if you don't have the trained staff, it doesn't work. It doesn't help. And that's exactly the same with incinerators. Incinerators can be useful and an essential part of waste management. But this belief that just buying an incinerator solves the problem has to go. Next slide, please. There is excellent guidance available on how to select, use, install, operate an incinerator. And I'm sure many of you have never seen it. The links are on the screen. Please do take some time to look at them. Far too many incinerators have been procured, more commonly donated to countries, and they don't operate. They're just left rusting away. In South Africa, the famous one at Bloemfontein is a rather excellent medical waste incinerator. It's just abandoned, been closed months ago. Next slide, please. Many years ago, Prof. Picken at the De Montfort University in the UK designed a low-cost basic incinerator for low-income countries. It's called the De Montfort University Incinerator. The point about this incinerator is it has dual chamber. It raises the temperature in the second chamber to around 800 centigrade with a retention time of at least 1 second, which basically means it meets the Basel Convention guidelines for medical waste incineration at that time. Since that time, the guidelines have been resolved, been increased, and the De Montfort incinerator design has been improved as well to help meet the new guidelines. So what a wonderful idea. You get the plans, you can build it yourself, less than $1,000. All kinds of fuel you can use: wood, coal, oil, gas. You can even use waste packing material. You can even use the cardboard as the fuel for the incinerator. Why is it not being used? Why does nobody know about this De Montfort incinerator? It's very low cost. You can build it yourself. You can have right next to the hospital, right next to the laboratory. You can have it there. And it meets the environmental standards. Next slide, please. We look at the example of Kenya. They had 44 of these De Montfort incinerators. Half of them were not working. How can they be not working? You can use anything as the fuel because nobody wants to know about waste. Nobody wants to manage it. There's no staff. There's no budget for its operation. It's just left abandoned. And that's why I make the point about incinerators. The equipment on its own is useless. If you don't have a full waste management system, it's not going to work. Exactly the same situation in India. 1 to 2 years after De Montfort incinerators were installed, not operational, not working. No trained staff, nobody knows how to use it. Nobody wants to use it. Nobody wants to have anything to do with it. Waste is a forgotten area. Next slide, please. So why have we got all these problems with this not working? Because often there's no waste management budget. Why is there no waste management budget? Because we've never asked for one. No one is in charge of waste. The message that I keep repeating is waste management is an integral, essential component of laboratory management. You must manage your waste. And that means having a waste management budget. And that means staff training, both lab staff and waste operatives. We can't keep using unskilled labourers with no information and no knowledge to handle hazardous waste. We have to have supervision by educated people, trained people who understand the importance of waste management. Next slide, please. Well, what can we do? What can we do about this? There already are excellent guidelines and good practice guidelines for laboratory waste management. They already exist. They existed for more than 20 years. We have a full series of WHO guidance documents. I doubt many laboratory staff have ever seen them. Monitoring tools, cost assessment, rapid assessment, policy papers, national plans, waste injection, waste at primary healthcare centres, immunisation, waste and emergency, a full set of documentations on what to do. We have to integrate waste management training into laboratory operations. It's an integral part of the process. Next slide, please. There are specific guidelines available for laboratory. Here are just a few examples of what's there. Excellent, clear guidelines are available on what to do. Point is to adopt and use them. Next slide, please. Well, my starting question, to what extent does clinical laboratory waste management need to adapt post-COVID? In the sense of guidelines and policies and procedures, almost none. There's a little bit about the PCR testing. We shouldn't use bleach, we should use alcohol for decontamination. Just one slight little bit of technical component, but the vast majority is already there. We don't need anything new, we don't need anything extra. What we do need is to implement it, to actually do it. We've had these policies and guidelines and procedures for years. We're not doing it. That's the big change that we need. COVID didn't create these problems. It highlighted the problems and the frank neglect of waste management that we had. We cannot neglect it anymore. We must now embrace waste management and make it an integral part of our operation. Next slide, please. So what is the impact of COVID? It's highlighted that neglect. It's brought increased volumes. And frankly, these larger volumes are here to stay. Not at the peak of COVID. We've come down from that peak to lower levels, but they're still higher than they were before. And they're going to remain higher than they were before. So we must implement waste management. There's one or two little technical issues around the GTC, but mainly it's just implementing what we already should have been doing. My key message, implement good laboratory practice for waste management. And I think I'm just on time to complete. I think that's the last slide, yes? Yes, okay. Then I hand you back for the panel discussion and the Q&A session.
Yes, thank you very much, Prof. This is a very interesting topic. It's actually heartbreaking because I think most of us in here know that we are sinners when it comes to this, because as you were giving this talk, I felt like you've probably been to my lab and you've seen how we poorly manage our waste this side. And one of the things that I just want to comment on, Prof, is that this talk probably highlights a bit why we also now, especially in our case here at home, whereby we have a few studies, actually not even a few, quite many, but there's a group of researchers who are looking at wastewater and SARS-CoV-2 in wastewater. And as you were speaking, I was wondering if the presence of SARS-CoV-2 in wastewater may also not be due to our poor handling of the wastes itself, because although we think this could actually be coming from the patients, but it could also be linked to how we tend to be careless in terms of how we dispose of the waste. And I also felt that when you mentioned plastic, I was a little bit encouraged, knowing from what you said that lead produce very little, I think you said about 0.02 of plastic per person, while hospitals are actually producing about 2 kilograms per person of plastic. Now, I was thinking that maybe this talk should also be given to the hospital clinicians and the hospital management so they can also be heard and know what we're feeling here. But thank you very much, Prof. I'm going to open the discussion now for questions. I haven't seen any question except for one person who wanted to apply for, let me see. Yeah. Okay, I don't see any questions unless you guys can see them on your side. I saw one person who's interested in applying for the courses, but I think this person will be able to communicate directly with the Empower School of Health. But in any way, any questions from the audience? If you have any questions, please let us know. And all the participants will be able to give an opportunity either to send your question through the chat or otherwise you can unmute. I don't see any hand right now. Let's see. I don't know if Prof. Rajiv is in the audience also, because I know he's also one of the panelists.
Okay, I can see 2 questions in the box, so I'll perhaps try and take those.
Okay, yes.
There's one around GLP waste management for the COVID PCR testing. Yes, there is a WHO document and presentation on how to handle that. Basically, the decontamination is done with alcohol, 70% alcohol instead of bleach. Many labs use bleach, just a large bucket of bleach, and put contaminated items in there. Instead of that, you use 70% alcohol. You'll find the WHO document available online for waste management of COVID commodities. One other question is on biodegradability of plastic. It's in 2 parts. For the non-hazardous plastic, yes, that is possible, but frankly, in most of the countries in Africa, sunlight will degrade the plastic quite quickly. But you can use biodegrading techniques on the non-hazardous parts. It cannot be used effectively at present on the hazardous items. Those are the 2 questions I saw. If there's more, and perhaps if Dr. Ian also wants to respond. Not just waste management. We have 2 questions.
Ian, yes, and then we'll come to you, Yusuf. Let's go to Dr. Ian quickly. Yes, Doctor.
All right. Thanks, Bettina, and thanks, Prof. Bakla. It really highlights the importance of sharing knowledge among ourselves about what's available out there, and also reminding each other what's available, and also empowering one another with the knowledge that is powerful, which enables us to handle the waste that we have within our labs and which we produce in our labs. And really, it's an issue that is on my heart, because we know what we produce, we know the danger of what we produce, and we have to handle it responsibly, and we have to remind each other to be ethical in how we deal with our waste. There is a cost involved, but it's part of the operation costs, and we owe it to the environment. We owe it to those who are not knowledgeable of the dangers of what we use in the lab if our waste is disposed with other waste. So it is an important area, and we really need to make use of the training. And also, I'm grateful that all this that we are doing is recorded, so that you can go back and listen where you didn't hear properly, and you can also share with colleagues who are not here, so that we can improve the operations that we do in our labs in Africa. And it's an opportunity for us to share experiences, to share how we have been able to do it. We might not have questions necessarily, but we may be able to share our experience so that we may learn from one another. That's the beauty of technology. It is allowing us to come together, learn from one another so that we may ensure that we have the best practices. Thanks, Bettina.
Thank you. Thank you very much. Before we go to the what's placed in the chat, I think we had one hand up. I don't see it anymore. I don't know if that hand has fallen off. Let's see. I don't see any hand anymore. Maybe the answer, no, it's gone. It was, I think, Yusuf, but maybe the question has been answered. It's fine. Prof, I also see there are questions in there, but I would like to attend those that are really talking about registering or asking about the course. If it's okay with you, we can attend to those last, and we can just try to focus on the content of the subject of this meeting, and we'll go to those if it's fine with Prof. Andy.
Yes,
now, while I'm awaiting for other questions, I just want to ask, because what we do here in our lab, we also have contractors who come diligently dressed up, ready to pick up our waste that are wrapped up in boxes, and they disappear. Now, the belief has always been that these are disposed properly. They will do it according to the expected procedure. But from what you've said to us now, probably the lab is not doing enough in terms of ensuring that is actually the case. Because when they come to collect material here, the boxes sealed nicely, sent away. The expectation is that the disposal will be according to the expected procedure. Now, my question is, what can the lab do to ensure that the contractors are doing what is expected of them? Because obviously, if they are sinning on the other side, we contributed to the sin because we didn't get them to account for what the agreement is between us and them. But how do we ensure that this is done accordingly? Does my question make sense, Prof?
Yes, of course. And to try and answer that, it's in two parts, really. One is that there are spot inspections. You actually go and take it through. The other one is you actually track the rubbish through, you label the bags, and you follow them through. And that's normally done in conjunction with the Environmental Protection Agency. As a laboratory, you don't have legal authority on the waste once it's handled to the contractor, but the EPA does, the Environmental Protection Authority. So in conjunction with them, you follow it through to its end disposition, whether that's an incinerator or a land tip waste disposal site. And it's really that monitoring of the process that is required.
Right, thank you. Thank you very much. Let's see if there are any more questions here. Which is the most effective way to handle plastic waste? Was this not answered? Was it?
Yeah,
it was, right? This was answered.
Basically, segregation is the key. Segregate hazardous and non-hazardous waste. The majority of the plastic is non-hazardous. That can go to many treatment sites. It can go to landfill sites safely.
Okay. Okay, the next one is quite lengthy from Heyday. I will go back to the courses afterwards. Thank you so much for the brilliant presentation. The lab may be doing every effort to improve in quality lab practice, including waste management, but the hospital administration may not collaborate in providing the financial support for these quality management systems strengthening. How does the lab go about to convince the hospital administration on the need to support the lab in the quality management service, including waste management?
Okay, perhaps I'll start and then Dr. Ian can add to it, yeah?
Okay.
Part of our requirement, part of our skill mix now is it's no longer enough to be a technical person. Now you have to be able to advocate. You have to be able to advocate for your operation. You have to be able to convince management and finance of the utter need. And that means having the knowledge, having the evidence-based to undertake that advocacy. But you don't have to do it alone. There are many bodies and associations that can assist you with advocating for that. Around waste, the foremost one is always the National Environmental Protection Agency, the NEPA. They will assist you, they'll help to bring it forward as well. And maybe when the law, and many countries have laws on environmental protection that most lab people don't know anything about. So it's a case of becoming knowledgeable in that, and that then gives you the power to advocate for it. It's not easy even then. You have to convince people who don't want to know that that is an essential part of the operation. Okay, over to Dr. Ian then.
Thanks, Prof. And it really brings this issue that's important, that we know that traditionally people who chose to do lab medicine were people who were reserved, who wanted to work behind the scene. And when now they go out to meetings, they are not outspoken to be able to present what their facts and be able to stand for the lab. And it is also part of what we are advocating and what we are doing in training, include communication as part of the training of lab medicine personnel, and their ability to be advocates, as rightfully said by Prof. Bartlow, so that we can be able to advocate for what is essential, the cost that is involved for all the consumables, for the quality control, quality assurance, accreditation, management of waste. That this is really important to ensure that we have a quality result. And the benefits we got from COVID, everyone now knows the importance of a lab result, no matter how big or small. And this helps us in our ability to advocate for budgets, for ensuring that the practice that we do is at the acceptable standards. And one thing that we should also do as lab personnel, let's not accept to work using unethical means, and draw a clear line to say, this is the minimum acceptable standards. If it's not available, we are unable to produce results, no matter what threat or whatever is said, because a poor result is worse than not having a result at all. So standing for ourselves and the waste that we produce and the needs that they have in the lab will enable us to be able to get the right budget and be at the right place where we belong. Thank you.
Thank you very much, Ian. I agree with you 100%. I like it when you emphasize that poor quality is actually more costly than quality itself. So we should actually be willing to spend and to save our patients. And if we shy away from spending, we have actually seen with COVID that we can actually harm patients while we overlook the value of good quality. Now, I want to go to the next question. Someone asked, how can we dispose of, I think, glass slides, they said. How can we dispose glass slides?
Okay, that's in two parts. First is to decontaminate and render safe. So that can be either bleach or alcohol or autoclaving. Then there's the actual disposal of the treated item, the glass itself, and that can go to ordinary landfill. Again, the volume of waste generated by laboratory is a small fraction from other healthcare operations. So going to landfill sites, once it's rendered safe, is rarely a problem.
Okay. And Prof, someone, or even everyone actually, it says here, are we going to receive the certificate of attendance for this session?
I'll pass that one to Sonia, I think.
Okay. Then the next question, yeah, that's fine. We'll include
Sonia
that.
is also unmuting a mic. Yes, we are working towards that, and one of the things that we are doing is we are working on the logo for the African Consortium on Lab System Strengthening, so that it can be on the certificates and the Empower School of Health logo. So we should be able to do that in the near future. We are concluding on that, and really you are right that it's needed one in as much as we have got the knowledge which we have got, but we also need it for our continuing education proof for us to be registered as practitioners. So we do get you. We are working on that, and that should be available in the near future. Sonia, I'm not sure if she would want to add anything on that.
No, that's all. And you have already mentioned that it will be available, but not for this session, maybe for the upcoming session. Thank you.
Thank you, guys. And the next question is, what is the role of the government in waste management?
Okay, it seems to be all waste, so rather than
yes,
today. But, okay, right. The goal of the government is to set the policy and the guidelines for waste management. That they normally do through the Environmental Protection Agency, the NEPA. The initials vary, the names vary a little bit between countries, but nearly all countries now have an Environmental Protection Agency. The problem is it often doesn't go outside that area. And that needs to go into medical waste management, laboratory waste management, pharmaceutical waste management, and all the other waste management areas to know about the regulations and about items like the Basel Convention. Most governments have signed the Basel Convention on waste. And yet few people in the country know anything about it. So your country is subject to an international convention on how you will treat and dispose the waste, and which prohibits you from exporting the waste. That's something that governments have already done, and we don't know about it. So one area governments need to improve is socializing the laws and regulations which they have made, because often they're not known about. But that's the role of government, to set the laws and regulations.
Yeah. Yes.
Yes, Prof, I do agree with you that the government is essential at policy level, and it's important also for in terms of setting regulatory agencies to be able to look at how we are complying with these laws that are set up. And it's essential and it's ethical for us as scientists. We know what we are producing within the labs, and we need also to advocate for the waste management, which is ethical for a lab, pharmaceutical, medical, that is handled in an ethical way that doesn't expose those who are working on it and the population to some hazards coming from the lab. So really, as a lab, we also have an important role to play in advocating for this.
Yeah, absolutely. I agree with you 100%. And Prof, on the issue of plastic, my expectation is that recycling of the plastic waste should probably form a big component in terms of handling it.
Yes, because the majority of the waste is non-hazardous. That can be recycled. The small amount of plastic, like the rapid test kit cartridges, which are hazardous, they can't be recycled easily. They have to be destroyed. But the bulk of the plastic is non-hazardous. It's the packaging material, and that can be recycled.
And Prof, if one were to look on the issue of decontamination, but chemical decontamination, not the incineration, would that not place them in a position or state of actually being amenable for recycling if they are decontaminated? I'm just thinking of all these other, like the little kit of the point of care testing that is obviously going to be contaminated. But if it is possible to decontaminate it chemically, would that not have an opportunity to go into the recycling bin? Basically,
it's possible, but it's not so easy because they are still chemically toxic.
Okay.
So although they are no longer infectious, it's relatively easy to treat them to be non-infectious through bleach or autoclave. Yeah, they still have toxic chemicals inside. That's more difficult, and that limits the amount you can recycle.
Someone is also asking, or it's a comment, there is standard regulation. Is there standard regulation? I think you covered this when you were indicating to us that there's actually guidelines that we should all be aware of, and we probably are not. Am I correct to say that in the question raised by Ali?
There's a full set of WHO guidelines. Most countries have regulations, but there will be environmental regulations. They'll specify what you can do and can't do. And most lab staff don't get trained in environmental regulations.
Now, at this point, I would like us, thank you very much, Prof, for that explanation. I would like us to go to the questions we had on the course itself. I saw many people being interested in the courses and also wanting to collaborate. So I would like us to address these requests from the participants.
Okay, the Empower website has links to all the courses that are available. The prices on the courses are there. You'll find 2 or 3 free courses that are available as well. Please look through on the Empower website courses. You'll find all the information, all the details there, and there's a wide variety from the master's degree program to postgraduate diploma through to individual short 2-month courses. A vast range possible. It's online training. You can work at your own pace, provided you stay within the overall time envelope.
Thank you, Prof. And someone wanted to know about collaboration.
Well, please contact us and we'll see what we can do. Yeah,
Okay.
we're always happy to discuss. It is probably not appropriate for a webinar like this. We need to be.
Yes, no, definitely. Yeah, we probably need more answers. Yeah, there's quite a few on actually. They really like this forum, and it's actually exciting, I must say, to actually see so many young people saying, I'm interested. I want to do a PhD in this. I want to do an MBA. I'm interested. This is really exciting. And I don't know if there are any questions to see on your side or any hand raised if I'm missing any. But I want to talk about Kelvin. Kelvin sent us a picture on the chat, and he says, this is how we dispose plastic in Tanzania. Now, I'm not sure what Kelvin is showing us, but it looks like there's plastic that's been covered, almost like probably being decontaminated in a heat. There's a big, I don't know if you can see this image, Prof. and Ian, can you see the image that he placed in the chat?
Yes, you can see it's a waste dump of plastic bags.
Well, yeah. Would that be the recommended route for disposing plastic?
Absolutely not, no. If we're going to go, absolutely not. If we're going to go to landfill, and landfill is an accepted technique, we have to dig a trench, we have to put the material in, we have to denature it so it can't be reused.
Yeah.
For example, if you've got bottles that are labeled with chemicals, somebody might try to reuse it. So we have to denature the labels as well. So it's important that everything is put beyond use. Okay? And for the top end of the toxicity hazardous material, we cast it into concrete. So typically we take a 50-gallon oil petrol drum, put some concrete in the bottom, put the waste material in, and then pour concrete slurry in, let it set hard, and then we use that to go to the landfill site. Dig a trench, put it in, it's inside concrete, nobody can get to it, nobody can reuse it. So there's a whole series of techniques.
Oh, okay.
Sorry, Ian, go ahead.
Oh, I thought he had completed. It also points out to the importance of us in the lab being advocates of the population in terms of the waste that we know is the hazards and its dangers. And you would see people now picking those from those dumps, and we should be able to use the knowledge that we have gained to be able to empower ourselves to share with the policymakers the essential issues to be dealt with so that the population can be safe. And it's unethical for us to turn a blind eye on it when we know what we are exposing the public to.
Quite right. It's the ethics, it's the morality of the situation as well.
Thank you very much. I don't see any other questions, and I am concerned we're running beyond time now. I just want to thank everyone for really contributing to the questions and the answers. And now I'm going to hand over to Dr. Ian to close our meeting. Thank you very much.
Thank you very much, Dr. Bettina Chale-Matsau, for leading the discussion well. And I would like to thank Prof. Baklo for the insightful presentation, and all of you for attending and ensuring that we learn from one another. And it is our desire as the African Consortium of Laboratory System Strengthening that we need to cause a difference in how we are doing things in the labs in Africa by learning from one another. And we would want to thank Sonia and the team behind the scenes for ensuring the smooth operation of the webinar, Prakesh, Sonia, and all the other colleagues. And on behalf of the African Consortium of Lab System Strengthening, which is the University of Zimbabwe, Department of Laboratory Diagnostic and Investigative Sciences, Cape Peninsula University of Technology, Department of Biomedical Sciences, Stellenbosch University Division of Chemical Pathology, and University of Pretoria Department of Chemical Pathology, in collaboration with the African Federation of Clinical and Laboratory Medicine and Empower School of Health. I would like to say thank you very much for attending, and please note that these webinars and the previous webinars are available on the Empower School of Health. Empower School of Health graciously host these seminars on our for us, and Empower School of Health do also keep on their website the previous webinars, so you can be able to go in, listen, learn from the previous presentations and this presentation, and use it as a tool in your labs and even in your training schools to strengthen the lab capacity in our African continent. And please be on the lookout for more webinars that we will have under the banner of African Consortium of Lab System Strengthening. On the 28th of April, we will be having one where we'll be talking about the lab career and opportunities and its impact on the fight against viruses, the present and the future. So please look out for that advert and register, share with your colleagues, and be part of the learning process and be part of the group of ensuring that we have quality lab services in Africa, which is ethical. Thank you very much. Let's have a good rest of the day. Thank you very much.
Okay, goodbye to all.
Goodbye, Prof. Baklo. Thank you very much.
Thanks, bye.